Kaohsiung Tzu Chi volunteers delivered 5,500 face shields to 14 hospitals, hoping to support medical workers. Besides droplet infections, COVID-19 can also be transmitted through aerosols. Welcome to DaAi Headlines, I'm Hu Chao. Thank you for joining us. In Taiwan, Kaohsiung Tzu Chi volunteers have started making face shields for medical professionals since last year. Recently, volunteers have delivered 5,500 face shields to 14 hospitals, hoping to support medical workers.
Volunteers packed the face shields into the boxes, which will be delivered to different hospitals. They've also pasted usage instructions.
It can be used repeatedly, even when disinfected with alcohol.
The 5,500 face shields come with volunteers' best wishes.
On behalf of our Dharma Master Zhen Yan, we want to bless the medical staff and express our gratitude.
Volunteers deliver face shields to hospitals in need of pandemic preventative supplies.
As we order the supplies from different companies, because many hospitals need these supplies, so we cannot expect the date we can receive the supplies. We are very grateful to Tzu Chi for helping us. This is very good. Wearing these, we can prevent infection.
The medical staff signals the love sign to thank the volunteer support. On June 18th, the volunteers divide into teams to deliver face shields to 14 hospitals, ranging from Qishan to Qijing.
We have distributed the supplies to all 14 hospitals in Kaohsiung, so we have arranged all the resources.
Kaohsiung City volunteers have started to make face shields since last year. Recently, many local hospitals have expressed the needs of the supplies. Volunteers donated face shields to 14 hospitals, hoping to support the frontline medical workers.
In Dalin Tzu Chi Hospital, a grandfather, father, and a 1-year-old son were confirmed positive for COVID-19. Only the mother was tested negative. Medical workers took on the role of a mother to look after the 1-year-old child. The 3 generations of a family were all confirmed positive for COVID-19. The grandfather, father, and the 1-year-old son was moved into a dedicated ward as the medical team took great care of them. This is our first time treating a 1-year-old child. We have to take care of him since the mother cannot be in the hospital. We have to also feed the child formula drinks. The father and grandfather have to take care of this child. So to the child, actually he is living in a new environment without his mother. This brings pressure to him and also brings pressure to our medical staff. Since the child is living in a new environment, he often cries while drinking formula. Nurses blew gloves into balloons, comforting the confused child.
Because I'm a mother too, so I felt bad for the child. He has undergone the suffering at the age of 1.
The virus has blocked face-to-face interaction in this family. Thus, the medical team uses great love, providing warmth to the family while they make it through the quarantine period. Taking care of a COVID-19 patient requires the efforts of a hospital social worker. In Taipei Tzu Chi Hospital, social workers help the senior buy a phone charger, allowing the mother and son to stay in contact. To these patients, social workers are like family members. During work, hospital social workers head out to convenience stores. After checking out, they met another co-worker. These supplies are for each dedicated ward. Since some patients did not prepare enough living supplies before entering the hospital, social workers must do the job of purchasing supplies. Besides the normal days in the hospital, social workers also discovered that the pandemic has not only affected people health-wise, many people lost their jobs during their stay, and when they return home, there is no monetary support to help them get through tough times. Actually, many people worry about the unfriendliness of neighbors and losing jobs. These social welfare policies, including the government's monetary aid or simple emergency assistance, allow people to have some cash while they are self-quarantined at home. Under the pandemic, many people face unsolvable problems. Though patients may leave the hospital with a healthy body, social workers from Tzu Chi Hospital made sure that the mentality of patients is also taken care of.
Social workers use a line group for caring. Not only do they have to purchase supplies, they have to also provide emotional support, welfare counseling, and funeral assistance.
We use our profession, combining that with social workers. Therefore, we are able to have a stable result when facing patients. Different patients suffer from different issues. With the help of social workers, their heartwarming actions has provided comfort to these patients. Since the pandemic broke out in Taiwan, the CECC has announced a nationwide third-level alert. Up until now, many medical professionals are still safeguarding people's health at the front line. Let's take a look.
After the China Airline Novotel Hotel incident, the group infection in Wanhua, and the group infection in high-tech company in Miaoli, the pandemic situation has worsened in Taiwan, causing chaos. The impact of the COVID-19 virus is beyond imagination. According to statistics, a flu patient might spread the disease to 1.8 to 1.9 people. For SARS, it is 3.5 people. However, according to CDC, a COVID-19 patient can spread the disease to 5.7 people.
Basic reproduction number indicates that without getting vaccinated and protective measures, how many people you will infect on average. This is related to the efficiency of virus infection.
The reproductive number will change after people take pandemic prevention measures, such as wearing masks, keeping social distance, and getting vaccinated. When people who have immunity appear, we need to look at effective reproductive number.
For instance, we follow third-level alert to decrease the effective reproductive number. When the RT number is less than 1, the pandemic will gradually disappear.
In
the quarantine hotel, the doctor provides online consultation. The patients who are brothers are only more than 10 years old. Pediatrician, also the deputy superintendent of Taipei Tzu Chi Hospital, Zheng Jingfeng, has discovered that family infection has become more severe.
After schools closed, these children or senior high school students stayed home. Later, they became infected at home instead of at schools. I took a look and discovered that they are usually infected by a senior member of their father or mother.
Since May 19th, CECC has implemented nationwide third-level alert. People are spending more time at home, and there's almost no way to prevent family infection.
After they were infected at home, they went to school, or they brought the virus back home from school. I think it is not limited to family infection. It has become local transmission. In the family, one member might quickly infect 2, 3, or 5 people.
From the statistics, when the RT number was at its peak, on average, one person will spread the virus to 15 people. After the government implemented third-level alert, until June 10th, the number has dropped to 0.7 people.
After the number drops below 1, the pandemic might ease. However, we cannot neglect our pandemic prevention measures.
The pandemic in Taiwan has become severe a year later than other countries. For instance, in Japan, the government was going to ease public health emergency by the end of April. However, due to the pandemic situation, they had to extend their emergency state. Meanwhile, in Taiwan, when will the government lift the third-level alert?
We will not decrease our alert level immediately after the situation improves. We still need to discuss carefully with the experts. However, look at the experiences of other counties. We cannot relax all at once. Once we decrease the alert level, we also need to change our attitude in daily life. We need to be pious and careful.
Many people are looking forward to the day the alert level can decrease. However, facing the threat of the pandemic, people must stay pious and vigilant.
Last year, the WHO declared that aerosols is also a carrier for COVID-19. Besides droplet infections, the COVID-19 virus can also be transmitted through aerosols. But how so? How do we prevent this from happening? Here's more. On May 13, 2021, a 19-year-old college student from China Medical University went to a karaoke place with 11 classmates. On the other side, there are also students from Zhaoyang University of Technology. Though both parties never interacted, on May 20th, the 19-year-old college student was confirmed COVID-19 positive.
Our respiratory tract has some mucus, so when we breathe in the air, some liquids on the mucus will become aerosols coming out into the air. On April 30th, the WHO has officially recognized aerosols as a COVID-19 carrier. It not only transmits the virus within a short distance, it can also carry the virus in long distances.
The aerosol particles in COVID-19 can be like this, floating from one room into another.
新冠病毒原则上是经由人喷出来的飞沫传染的。
COVID-19 is transmitted through droplets produced from humans. The droplets are like PM10, and these droplets become the size of PM2.5, which are aerosols. Since PM10 is heavier, it falls to the ground within 1 meter of traveling. But if it's PM2.5, it floats for about 4 to 8 meters.
但是你如果是 PM2.5 的话，它会飘得比较远，大概是4到8公尺左右。
In Kaohsiung, customers from a seafood restaurant were confirmed to have COVID-19 besides contracting the virus at the bathroom. Some experts suspect that the virus was also transmitted through aerosols.
气胶它就是英文叫 aerosol。
Sometimes when we hear aerosols, it means the tiny particles that float in the air, which is also tiny droplets. Droplets can be produced through breathing, which happens when we talk, breathe, sing, or cough.
呼气单纯的呼吸或者是唱歌、咳嗽，都有可能会产生这些所谓的呼气的气胶。
Clouds, fogs, and volcanic ash are natural aerosols. The pollution particles from our vehicles, PM2.5, is also an aerosol. When the pandemic first started, many experts thought that the virus was transmitted through droplet infection, but the recent mass infection cases has led the CDC in the United States to confirm that COVID-19 can also be transmitted through aerosols.
那要阻绝气胶它跟目前
To prevent aerosols, it's quite different from our current COVID-19 prevention measures. When we wear a mask, the way we wear is very important. Because some researchers show that both medical masks and N95 masks will have less of an effect to prevent aerosols when a small hole is created.
1%或者是2%的缝隙的时候，阻绝气胶的效果就会大减。
Through the laboratory footage, virus becomes visible once the patient sneezes and coughs. Even with a mask worn, the virus can be transmitted through aerosols.
When you open a window, microdroplets are quickly swept away.
In the United States, CDC has provided a new COVID-19 guideline, stating that COVID-19 may also spread through aerosols. And the 1.8 meter social distance with a COVID-19 patient still provides the possibility of infection. In Taiwan, our guidelines show a 1.5 meter social distance, but professionals suggest that the risks are still there even with social distancing. How do we avoid viruses in the air? Due to lightweight, aerosols are easy to spread through air, so it's best to bring in air from the outside to indoor locations, decreasing the level of toxicity within the enclosed space. In a space with a patient, the act of exchanging air in the area is to be done 4 to 6 times per hour.
那气溶胶到底能不能传染呢？因为它已经散得比较。
Can aerosols carry the virus? Because when it spreads too far, the density becomes lower, so the possibility of spreading the virus through a respiratory tract is lower. The chances are higher when the virus is attached to an object, and when someone touches it, the virus will be transmitted onto the person. Within each breath, the chances of spreading the virus increases. What we can do best to prevent such thing is to wear our mask properly, wash our hands frequently, and maintain social distance. Yao Shufen is a cemetery caretaker. In September last year, she adopted Qing San, who was 30 years old. Although the two were not related by blood, she regarded him as a family member. Although someone suggested that Qing San should be sent to a nursing facility, she was reluctant and wanted to take care of Qing San to the end.
I help others manage the sanitary, and I do the work of weeding and watering. I just water it and collect the bones. I help the master prepare items for worship. Those who don't understand, I will help them prepare items for worship. He's not stupid. He has been in high school. He has really gone to high school. It is not that he hasn't studied. He was hit on the head. He now has a 7 or 8-year-old kid's IQ. He will go wherever I tell him to go, and he will go when I drive him. He had been in 2 car accidents and didn't die, so he is lucky. Everyone will say that I raised this person because I was asking for trouble. I say it doesn't matter. I pity him for having nowhere to live, and his mother is mentally handicapped. Otherwise, how is it possible to let his son be taken care of by others and go to other people's home to eat and live with others? It's because of his mother's situation that she wouldn't like it otherwise. When he first came, he would also say that my aunt drove me and didn't want me. I asked him, "Do you want to live with grandma or Taichung?" He said, "I want to live with grandma." We have established a relationship and have lived together for several months. This is Grace over there. You go find Grace. I bought a suit for him yesterday. His pants are too long. He wears them all the way here. Some shoulders are torn apart. I don't know how to shave. I bought him a razor and she cut himself. His aunt was here and she thanked me. She asked me to send him to the nursing care institution. I think he is not old yet. If she is sent to institution, it will cause a burden to others. It doesn't matter if he lives here obediently.
Next, let's meet Christian de la Torre, who is originally from the Philippines and has been studying in Taiwan in Tzu Chi's long-term care course, associated with Tzu Chi University of Science and Technology. Christian hopes to do his best and become a great caregiver, so in the future, he may take good care of his grandmother.
郭妈妈，这个是什么？葡萄。有什么颜色？紫色。对，很棒。我是唐迪恩。
My name is Christian, and I'm from the Philippines. I'm here in Taiwan studying because I want to help my grandmother and my family.
所以我来这里读书。
From when I was young, my grandmother would take care of me. She really loved me a lot and helped put me through school from elementary to high school. She took care of me, so when I grow up, I want to do the same and take care of her.
然后超过她。
把你的身体带上一点旋转，往前画半圈， The 瑞智义 Academy is actually just a community service point for dementia sufferers. Currently, there are 20 community residents who come here to attend our lessons. We are the first one to be established inside a school of science and technology. This is also a place where our students from the nursing department or Philippines long-term care course students come do their internship. We're playing a matching game with pictures. It helps to stimulate my brain.
Chinese is harder than English. The Chinese grammar is not the same as English. If your Chinese is not good, then you can't communicate with the elderly here. So I'm working hard and learning the language.
最会的台语是什么？你别给本少不，然后吃饭啉水。
我没有了，我跑到哪里去了？我就没有了，没有了，我的狗不见了。我怎么没有？讲得很流利。
Their Chinese is very fluent. I'm surprised they blend in so well with us. Have such a grasp of the language. I don't feel like they are Filipinos at all. I'm so impressed.
老人没去厕所3天，医生说他有便秘。
让我最开心是
Makes me happiest when I get high marks in exams because I know my hard work has paid off. It hasn't gone to waste.
努力的学习没有浪费。
When the Long-Term Care 2.0 launched, we needed many talents to carry out the initiative. This is why we thought we could tackle the problem of education and poverty with nurturing talents. We do a lot of charity work in the Philippines, so if we provide them with an opportunity for education and work guarantee, then we can help them change their life around, while also solving Taiwan's crisis of not having enough manpower to cover long-term care.
The next we will talk about the pulse rate because nearly the caretaker temperature a little high.
希望不会
I hope to use what I've learned to take care of people and become a great caretaker in the future.
成为一个很好的照顾服务员。阿公阿嬷，大家好。好，我是唐迪恩。
During graduation season, many schools held online graduation ceremonies. Pingdong City's Tangrong preschool students recorded a song to appreciate frontline medical workers. As this is done before the level 3 alert, we will leave you with these images. Thank you for joining us. Goodbye.